I've decided to just we haven't tested the pectoralis major, so I'm just doing that right now because I'm interested. So pectoralis major goes to +2 degrees, the sternal portion. And if I may get my hand under here, it's only at about 95 degrees for flexion. And then for the clavicular portion, which is where you were complaining, we now have +20 degrees. Okay, so let's deal with the pectoralis a little bit. So I'm going to treat the pectoralis major, and I'm also going to be thinking of improving her abduction and perhaps her internal rotation as well. Okay, so let's start with the pec major in the sternal position. And we're going to scoot that over. So now, you can contract this muscle while I'm working, okay? So hold your arm there. Got it? Hold it against me, okay? And just contract it. And then very, very slowly let it go. Very slowly, but leave some reaction to my pressure, okay? So you're going to slowly lower it against pressure. So don't just drop it. Is that okay?
Yep. 0 pain.
There you go. Good. Okay, now I'm going to hook with my elbow. Resist me. Okay. And then very, very slowly let it down against my resistance. So just give up 10%.
Okay.
Okay. So this is an eccentric contraction of her left sternal portion of the pec major. Okay. Okay, come, let go completely. Okay, now come up a little bit. Resist me again. Got it? Harder. Good. Now only let me win by 5%. So we'll do another eccentric contraction, but you're only letting me go a little bit. Okay, nice deep breathing. You're doing great on that. Good. And good. Keep a little bit of a little bit of oomph here. Nice. Okay, and let go completely. So now I'm in the medial intermuscular septum. There we go. Okay, and we'll let this fall backwards. In fact, let's do a little re-education. So we were here. Push backwards toward the floor with your whole arm. Yeah, all the way back, just to where we were. Keep it there now. Don't let me move you. Keep it there. Don't let me move you. Okay, now let go. Push me back. Push me back. Push me back. So we're re-educating the new range we just gained. Make sense? Mm-hmm. Good for a weightlifter.
Yes, very good.
Okay, now let's do an eccentric coming back. So now give up by 10% and let me raise your arm. Let me raise it. Let me raise it. Let me raise it. Let me raise it. Now push backwards. Concentric contraction. All the way back, 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 all the way back. Good. Now let me raise it by 10%. You are strong. Okay. It's okay. It's okay. It's okay. Great. Okay, and then push me back. Push me back. Push me back. All the way back. All the way back. Don't straighten your elbow. Keep it slightly bent. Thank you. Push me back. Push me back. Push me back. Good. Okay. So, one more time, we're going to come up over the top of your pectoralis major. Okay, over we go. Yeah, you can push backwards, but without rotating. So I want you to, if any rotation, I want you to go that way.
Okay.
But not this, so push backwards. That's it. That's it. Okay, and then gently release. Okay. And push backwards. And release. And push backwards. And release. And push backwards. And release. Stay there. Bring this up again. Push backwards. And release. Push backwards. And release. Push backwards. Excellent. And release. Push backwards into me. Yeah, into my knee. There you go. And release. Push backwards. And release. Okay, now let's get a little bit of lats here and the teres major. All right, so I'm going to lower this table a little bit. You're doing great. Okay, and we'll have you internally rotate. So come this way and then release, okay? So push into me, keep coming, and gently release. And keep coming, and gently release. Okay, I'm gonna bring the scapula down a bit and readjust the table. So hold on.
About.
Okay, hold your arm right there. Okay, go ahead and bring your forearm toward me. And then release and go backwards. And go back and go back and go back and go back. Okay, and then forward. And don't bend the elbow, don't straighten it. Just keep rotating. You're bending it. So just come toward me. Yes, that's it. That's rotating. And then back to neutral. That's good enough. Come back, forward. Okay, and back to neutral. And come forward. And back to neutral.
Donna, can you explain where your fingers are working?
My fingers are in the medial intermuscular septum of the superficial front and back arm lines. So the biceps is here, underneath my fingers and thumb, and the triceps is posterior, back here. Okay, come on. You're going to practice internally rotating because you have excellent external rotation, okay? So this is the direction I want you to go. Try to keep your hand neutral instead of flexing it, okay? So you'll make yourself go further that way, okay? Because you won't worry about running into me. There you go. So just like that. So I'm working the triceps posteriorly as we work. And the biceps more toward myself, internally rotating it. Excellent. Okay.
Yeah.
Okay, so that helps clear that up a bit, getting some more abduction to happen. And we've certainly gotten the sternal portion of the pec, so you can see now that it falls way back here.